First, I want to talk about certain myths that people have, is that, and that's what I've heard from all the patients that I've come across. So when I tell them that they have a problem with alcohol, first thing they say that alcoholism is a disease of white people. They say, and when you look at the statistics, it's all over the world, in any race, any country you would go into, the incidence is same, and alcohol does not discriminate against your race or any gender. Secondly, people have told me that I've been told by my cardiologist, that alcohol is good for you, so that's why I need to drink. So that's also another myth. Eventually, it affects your heart muscles, so heart becomes weak, and that's when you have heart attacks. Do you know that most common cause in alcoholics of the death is from cardiovascular disease, and or the stroke resulting from cardiovascular disease? That's the most common cause. Now, third thing I've heard about from people is that they say, I don't have a problem, I can stop anytime I want. It's easy. But when you have heard today's stories about how many times they have to go through so many rehabs, how many times they have faced so many adversity, and still they would not stop drinking. I can give you one example of myself. I have a severe cramps, stomach cramps from any milk products, especially tea. And I tell my wife every day that I'm not going to drink tea today. Don't make anything for me. She makes the tea, I smell the tea, and I go and pick up her cup and start drinking. And still I have stomach ache, but still I do not stop drinking. So now I have appreciation for patients who do suffer from this addiction that is so powerful that it's very difficult to quit, and that's where I think the compassion comes into play. Now, I have practiced in so many areas, so many hospitals, and one thing that I have always come across is that, as Dr. Garifati has described before, is that when the patient comes in the emergency room, he has an alcohol problem, immediately everybody turns against him. They say he's just wasting our time, he comes here all the time, he's not going to change. So their attitude is different. And that's the first thing, as a doctor I have worked with, the first thing is that to tell everybody that it is a disease, it is a condition that needs a treatment, and it's something that every time you treat that patient, even though he comes back, you do leave something with him. If you show compassion, if you show some interest in the patient, it does change their life in some way. So you have to keep on trying. You cannot just give up hope on them and they say that it's not going to get better. Now, another thing that I have heard from the patient is that alcohol helps me to feel good and relax. And you heard that before, that people do that when they go to a party, they are feeling a little nervous. So what they do, they go to a bar, they have a few drinks, and they feel comfortable. They start talking more. But again, that issue comes with if you have more than 2 or 3 drinks, that's when it has a reverse effect. You become disinhibited, and it's no longer helping you in terms of being calm. Your personality changes. So that's another thing that not true. And other thing I have heard from the patient is that I drink because it helps me to sleep. You might have heard that all the time, and that's what the reason. What happens is that when you have few drinks, it does relax you. It's a depressing effect, so you fall asleep. But what happens after that is that alcohol wears off in around 4 hours or so, even less than that. You know that one drink, it takes 1 hour for our liver to digest one drink. So what happens is that once the effect of alcohol wears off, that's when you wake up. And also alcohol, when it's effective, it suppresses your REM sleep. REM sleep is the sleep where you dream. So when your alcohol wears off in the middle of the night, you start dreaming more because now you have opposite effect. And so this patient, they wake up frequently, also they dream a lot. So when next day in the morning, they are very tired. So let's go into the medical consequences of alcohol abuse. And let's see, I can move from here? No. Okay. So first thing is effect on the brain. And when you talk about effect, first thing is the blackout. You might have heard of people who drink heavily, and what happens is that they have no recollection of the events that occurred because they are awake, but they are at that time intoxicated. And you hear that from when you talk to people, that next day they say they don't even remember what they did. And this is what blackout is about. Secondly, sleep impairment, that's what I talked about before. And the damage to your brain, alcohol damages in so many ways. Not just the direct toxic effect of alcohol, but also because of the vitamin deficiency it causes. So what it does is that alcohol destroys the parts of the brain that are responsible for memory. Also, it can have effect on our mid part of the brain, and that it's a rare condition. But when patients have the destruction of that portion because of the alcohol, that ultimately leads to confusion, that disorientation, and ultimately it can lead to dementia and even death. So it can cause the death from effect on the brain. And secondly, we have a small part of the brain, it's called cerebellum, that is small brain we call it, and it is responsible for our helping in the balance and also the eye movements. So that part also gets destroyed from alcohol, and that's why people have balance problems, they cannot stand properly, and also they will be falling frequently, and their eyes can also be flicker, and that's the vision gets affected. So effect on the heart and the blood vessel. That's what I just touched upon briefly before, is that alcohol at the high doses and heavy drinking, it damages the heart muscles and makes the rhythm irregular, and also the cholesterol, bad cholesterol gets high and good cholesterol becomes low. So it has an effect on the heart that is long lasting. And most common cause of death again is from cardiovascular accidents, and mainly the effect on the heart. And also heavy drinking increases chances of blood clots, and that's also another cause of death. Damage to the nerves, that's another thing that you might have heard, it's called peripheral neuropathy. And what it does is that not only just direct toxic effect of the alcohol, but also the effect of the vitamin deficiency. You know that alcohol is absorbed in so many ways. It's when you ingest alcohol, even your esophagus, your stomach, and most important part where it's absorbed is your small intestine, the beginning part of the small intestine. And that part is also responsible for absorbing a lot of vitamins. So when you are drinking heavily, that part gets very inflamed and it cannot let you absorb the vitamins. And that's what causes the vitamin deficiencies. That in turn can cause effects on your nerves and also your memory. Now, when the nerves are affected, people will complain about tingling, pins and needles in their fingers and legs. So that's commonly the effect of the alcohol. And also alcohol is a very toxic agent for muscles. So muscles get also destroyed, and it happens because each cell in the muscle gets inflamed and they are swollen and they cannot function, and that's what leads into this effect of weakness. And other thing that leads to is that muscle atrophy, that means that the muscles get destroyed. And if you look at the old people who are drinking heavily, that they might see that they might have a big belly, but their hands and limbs are very small because their muscles get wasted. And because of that also they are weak and they can have falls and they can have fractures from that. Now, most common effect of alcohol that you hear is the effect on the liver. Because whenever you talk about alcohol, people say, oh, it dies from a liver damage. But liver damage actually is not the most common cause of death, but still liver damage is the most common effect you can see. Now, if you start from inflammation of this because of alcohol, first of all, it affects the esophagus, and that's our food pipe, then the stomach and the intestines. All these areas can be so swollen from the alcohol that you can have, first of all, the bleeding, and also you can have just the damage leading into effects on affecting your digestion. So, and when this liver damage progresses, it also causes, you have heard of term cirrhosis. What it is that your liver cells are damaged to the point that they cannot keep the liver functioning, and that leads into accumulation of toxic substances in your body. Also, you have the liver cannot process all the blood coming to it from your intestines. So what it does is then there's a backflow of all the blood, and that leads into swelling of all the veins in your esophagus, your stomach, your intestine, and that also can lead to bleeding. So people have bleeding, and ultimately bleeding can cause anemia, and also this liver damage eventually can cause the accumulation of all the toxic substances that liver cannot process, and that leads into effect on the brain where you have confusion, or the patient can go into coma, and not only that, that can ultimately lead to the death. So it is an illness that really affects you in terms of affecting the whole body. The blood producing system. That's another thing that also you may not hear that commonly, but 4 to 8 drinks a day can reduce, increase the chances of infection, because our white cells count that help us to fight the infection, their production becomes low. Not only that, those white cells, when you know that when you have any infection in the body, they rush to a place and fight the infection. What happens with alcoholism, that alcohol affects even the migration of those cells to that particular part where you need it. So in alcoholics, they would not be able to fight the infection as a normal person would. Secondly, our red blood cells, they're the cells that carry oxygen in every part of your body. Those red cells also are not produced because of the direct toxic effect of the alcohol. Thirdly, then alcohol, what it does is that we have platelets in the body. The platelets are another kind of cells. They are responsible for blocking our arteries or veins when there is injury. So they are the ones that stop us from bleeding. So they are called platelets. And with alcohol also affects the production of platelets. So we don't have enough platelets to fight, to block those arteries, and that's why you will bleed more easily. So in terms of the blood producing system, it can have effect on your infection, it can have effect on your anemia, and also at the same time you can have effect on your bleeding. So it does have wide-reaching effects. Now, one thing also you don't hear about also is the second most cause of death in alcoholics is cancer. And the cancer is not something you would think that is the stomach, esophagus, but the stomach starts from the neck, stomach from head, esophagus, lungs, and also of colon. And all these cancers are more common in patients who are drinking heavily. And most devastating effect it has on is the women. Women with family history of breast cancer are 40 times higher to get breast cancer if they even have 2 drinks a day. So for women, even more than 2 drinks or 2 or more drinks is considered very dangerous. So that's something that to remember. And again, cancer is the second highest cause of death among people who drink heavily. Now, effects on developing fetus. That's another area of concern because alcohol and alcohol products, they all cross to the placenta freely. So whatever mother drinks, it goes into the baby. Now what it does is that most immediate effect can be the fetal death or spontaneous abortion. And if the fetus survives, then what happens when they are born? They can have severe mental retardation. Also, they can have their diminished size. Also, they are premature born. And most important thing that they can have a hole in their heart. It's called atrial septal defect. That means we have 2 chambers in our heart. So in between the chamber, usually there is a wall. And then with alcohol, there will be a hole in the wall. So your heart cannot function properly, and your brain doesn't, or whole body doesn't get the oxygen that you need to get. So it has quite devastating effect on the fetus. And as I mentioned, the alcohol affects every part of your body, every cell in the body. So from head to toe, it can have effect. And additional effects can be destruction of the testes, bone fractures, cataracts, dental problems, and accidents. They are the most something that you hear about. Now, alcohol in general, people who drink heavily, it takes away at least 10 years of their lifespan. So they have a short life compared to everybody else. So then it can be all the various things that I mentioned before. They can die from their brain damage, they can die from their liver damage, they can die from cancer, they can die from all the effects of the encephalopathy from liver failure. So they can have so many various ways to die. And this is something that's very important to remember because we always associate with alcohol with parties and all the fun thing. Anytime if you have a party, that's what people look for, is alcohol. And I think that's what is, as Dr. Prakash had mentioned about this associated thinking that we associate alcohol with the parties and gradually then it becomes a pleasure-seeking substance by itself. And that's what leads to all these negative consequences.